So hello, today we're going to look at ethical pillars of medicine. There are four ethical pillars of medicine, and first of all, we're going to start with beneficence. Actually, this one is actually very straightforward. We have to look at the overall beneficence. You just have to look at the overall benefit and determine if a certain action is beneficial towards the patient. Second one is non-maleficence. So non-maleficence is obviously not being malicious towards the patient, not giving harm towards patients. It might be simple in the surface, but it is not. So what makes this non-maleficence concept hard is that it often clashes with beneficence. On the surface, beneficence and non-maleficence might look like it is pursuing the same thing. It might seem like it is trying to help the patients. However, in the actions of pursuing these concepts, these two often clash. An easy representation example for this would be chemotherapy. So if we consider chemotherapy, it would be beneficial towards the patient because obviously it is a therapy, and it also has the potential to cure the cancer. It also has the potential to make the patient feel better and overall survive, which is beneficence. However, it also has the potential to harm the patient because chemotherapy is a treatment that involves lots of side effects, and it might also lower the quality of the patient because of extreme pain, hair loss, or etc. So if you think when we are making a clinical decision, we really have to balance between beneficence and non-maleficence, and this is the hard part of these two ethical pillars. These two, you can't just think as these two just goes together. They're like a pair when making a clinical treatment. The third one is justice. Actually, the justice here is not quite the justice you would be familiar of. The unit of justice here is the society, not the patient. Society as whole. So let's consider NHS. NHS has a limited fund, and it provides all the treatments and care for any UK citizens. So therefore, if the fund is taken by a patient and by a large amount, then that means that NHS might be lacking fund to treat the other patients and might give a poor quality of care to a certain person. So in this case, we have to see how cost efficient a treatment is. We can also refer to justice as opportunity cost. Well, it is quite tragic to see that we doctors or healthcare professionals have to determine the opportunity cost of treating a patient, but considering how the NHS actually functions, this is a key aspect which is needed. Actually, there's a very specific guidelines that the government provides from an institute called NICE, National Institute of Clinical Excellency. These these associations actually provide very specific guidelines to all the diseases and all the treatments that might potentially happen towards a patient, and also considering all the costs and also the opportunity cost of the treatment itself. One of the guidelines you might want to know is actually the main guideline about prolonging life. 30,000 pounds is a guideline that the NICE provides. It is the most generalized guideline. So 30, they say that if the treatment prolongs a person's life for 1 year, if this treatment costs less than 30,000 pounds a year, it is considered as efficient. Therefore, when you're given an ethical dilemma question, you might want to refer to the 30,000 pounds that the NICE provides, which is a clear guideline and which is a reference you could easily make, and also, it shows your understanding about the NHS and the NICE and the UK medical system. So consider memorizing these statistics. It might be very helpful. So the last but not least, maybe the hardest one, autonomy. Autonomy is making sure the patient is competent and is making uninformed decision. For this pillar, autonomy, to be secured, it has to be competent and it has to be an informed decision. These two factors here, competent and informed decision, is extremely important when referencing to autonomy. And this is a part where all the different ethical dilemma questions comes in. Ethical dilemma question about confidentiality, and decisions made by the patient, and trying to determine if the patient is competent or not, and all these ethical dilemma questions refers to autonomy. So you really have to remember that the autonomy is only assured when the patient is competent and is also having an informed decision. And actually, to determine if somebody is competent or not is really extremely hard, because we healthcare professionals are all humans. We don't know what that person is thinking. We don't know the whole situation. But lots of healthcare professionals and government authorities have gathered up together and produced a specific guideline, which we might refer to. So you might want to look at that. So the guideline for deciding if the person is competent or not is Mental Capacity Act. This was made in 2005, a bit old, but it still works. There's actually four steps for deciding whether an individual is competent or not. Okay, so the first is understands the decision. Second, retains the information. Third is balancing risk/benefit. but this is also referred as rational decisions. And fourth is communication to the healthcare professional. So, it is quite obvious, but it is actually quite effective if you think in these 4 steps. And also, we have to assume that a person is competent at the beginning. We should not assume that a person is not competent if before this test is done. And while we're doing this test, we also have to think that this person is competent while trying to test this out. For example, let's say a person has paranoid schizophrenia. We still think that that person is competent, and we're trying to see if this person is able to make, if we're going to assume that this person is competent, and these tests are done to prove that that person is not competent. It's like the other way around. So it's not proving that you're competent, but it's rather proving a person is not competent through these guidelines. So if these 4 guidelines is met, that person is considered as competent. For example, a person with schizophrenia with grandiose symptoms, thinking that he's a great doctor, had to amputate his leg or he had to die, but that person understood the decision he was actually making. He was able to retain the information. He understood the risk of risking his life, and also him having to amputate his leg. And he said that he would rather die instead of living as one leg. And he was able to communicate this decision to the healthcare professional, so that person did not amputate. And yes, eventually that person died. But if you consider these cases, even person with the paranoid schizophrenia can be competent, and we assume that these persons are competent at the beginning, and we could not prove that that person was not competent throughout these guidelines, and therefore that person did not amputate and he died. So if these 4 criteria are not met, and we prove that the person is not competent, then the healthcare professionals, doctors, comes in and considers the best interest. The best interest principle. The doctors has to consider which would benefit the patient most, and which would be the best interest for the patients, and the doctors are going to act on behalf of the patient and make decisions for them, only if the person is not competent.